sure to have all of the following items before you begin. 1 vial of Luveris 75 IU, 1 vial with sterile water, 1 syringe, 1 long needle for reconstitution and 1 short needle for administration, alcohol swabs, sterile gauze and bandage, safety container. Check that the Luveris diluent is clear and colorless. Do not use if the solution is cloudy, discolored, or contains particles. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Using your thumb, flip the protective plastic caps off of the vial of Luveris powder and vial of diluent. Wipe the top of the vials with an alcohol swab. Remove the wrapping from the syringe and long reconstitution needle. Twist the reconstitution needle onto the syringe. Carefully pull or twist off the needle cap. Draw air into the syringe by pulling back the plunger to approximately the 1 ml 1 cc marking. Place the vial of diluent on a hard, flat surface. Carefully insert the needle through the marked center circle of the rubber stopper into the vial of sterile water. Gently press on the syringe plunger. This will allow the air to enter the vial, which makes withdrawing the solution easier. Without removing the needle, invert the vial and slowly pull back the needle as far as needed to withdraw the entire contents of the vial into the syringe. Make sure the tip of the needle remains in the diluent by slowly backing the needle out of the vial to withdraw as much of the solution as possible. Remove the needle and syringe from the vial. Place the vial containing Luveris powder on a hard, flat surface. Insert the needle through the marked center circle of the rubber stopper into the vial. Slowly inject the sterile water into the vial of Luveris powder by pressing down on the syringe. Without removing the needle from the vial, gently rotate the vial between your fingers until all of the powder is dissolved. Do not shake. Without removing the needle, invert the vial and slowly pull back the syringe as far as needed and withdraw the entire contents of the vial into the syringe. Make sure that the tip of the needle remains in the solution by slowly backing it out of the vial to withdraw as much of the solution as possible. Remove the needle and syringe from the vial. Recap the reconstitution needle and remove the needle by twisting it off the syringe. Discard the used needle in your safety container. Remove the wrapping from the shorter administration needle. Twist the administration needle onto the syringe. Carefully pull or twist off the protective needle cap. To remove any air bubbles in the syringe, point the needle upward and gently tap on the syringe. When all bubbles have risen to the top, slightly press the plunger until a small drop of solution appears at the tip of the needle. Recap the needle. Choose an injection site as directed by your healthcare provider. Alternate the injection site each day. Clean the recommended injection site with an alcohol swab and let air dry. Uncap the injection syringe. Hold the syringe in one hand the way you would hold a pencil. With the other hand, pinch the skin around the injection site. Insert the entire length of the needle into the skin at an upward angle of 45 to 90 degrees. Once the needle is inserted, you may release the pinched skin and push the plunger in a slow, steady motion until all the medication is injected. Gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Discard the used syringe and needle in your safety container.